Good morning. So I'm so excited and so honored to be here. As Jonas introduced me, my name is Marina. You don't even have to remember my last name. It's very difficult to pronounce. Even my classmates cannot pronounce it. So I'll be happy to share my journey and how I build a AI tech startup, and so where I came from. And also I'll be happy to share the real life example how we use AI in our company, why do we use it, and how our patients and our doctors benefit from that. Originally, I'm from Moscow, from Russia. I live in New York, so I won't tell a lot about this amazing city where I live for the last 5 years, just because right now you know that it's like one of the best places in the world to live in. So I'm a medical doctor by training. I specialized in infectious diseases and vaccination. I was involved in clinical trials and research. And so as you see from my bio, I started the business 10 years ago, 9 years ago, but I only got the business education like a few months ago. So I'll be happy to share how I ended up studying as a medical doctor without any business education. I didn't know how to code. I still don't know how to code. How I ended up being a founder of AI tech startup. So I live in New York with my 15-year-old son. This is the journey of my company. So I started the company in 2014, and we started using AI in 2015. At that time, it was not a fancy word. People didn't know, like a lot of people didn't know what is it. So I'll share my journey why started we using AI, and not just because it was fancy back then. And we developed the technology, and in 2019 I moved to New York to develop business there. And one thing which was not mentioned on the previous slide, in 2021 we raised our first round of investments. Before that, I bootstrapped the company because, as I mentioned, I'm a medical doctor. Before 2020, I had no idea who VCs are, what venture capital is. So I started, just by doing. We built a prototype, started selling, earned a little bit money, extended the company, hired more people, grew more, and step by step. And actually by 2019 we got the 30% of market share in Russia, and we got the same as Invisalign. It's our biggest competitor back then. And then I used profits from my Russian business to fund the American business, and I moved there just because America is the largest orthodontic market right now. Why do we have here the picture from the movie 21? Because when I raised my first round of investment, so actually this movie is based on true story. It's a movie about the very talented math student from MIT, and he played blackjack to make some money because he was from poor immigrant family. And so actually Kevin Spacey was a bad guy there. But the story is based on a student. And after he graduated, he started a tech company, then he sold it, and then he started a VC firm. So he's one of our first investors. So that's why I just put this over there, just to start with a fun fact. Amazing movie, watch it over weekend if you have not. But yeah, this was my first connection with VCs back then. But why I started the company? I started it by an accident. So I'm a medical doctor. I had no idea how dentistry worked back then. And so I just started it by an accident. We had a high school reunion with my classmates, and one of them asked for my advice how to straighten his teeth. What's the difference between aligners, like Invisalign, and braces? I had no idea about that. But people usually ask for my advice, about blood pressure for their grandmother, or even vaccination schedule for their dogs and cats, even they knew that I'm not a veterinarian doctor. But back then I had no idea, but I was curious actually how braces looked like because I didn't have braces as a teenager. So braces is like with metal brackets and wires, which doctors have been using for 150 years already, and they haven't changed ever since. And aligners. Aligners actually, they're plastic trays, they're designed digitally, and then they're manufactured using 3D printers. And patients that change aligner after aligner just to straighten their teeth. Like maybe the biggest brand right now, like Invisalign or Angel Align in China. But the goal for the company was to develop aligners which could be as effective as braces, because back then and right now aligners are used mostly for mild cases and braces are used for like severe and moderate cases, which are actually like 70% of the market still like braces. And so this was the goal, and I thought, it's very clear, it's very obvious. There is a huge unmet need. I know how to do the study design because that was my background. I was involved a lot in research. So then we'll just do that. And for me, back then, it was very straightforward. But the next year we failed because our first software was no better than like competitors. And I didn't want to build a company, to build a product which could be the same as competitors but cheaper. So we really wanted, to develop aligners which could really compete with braces clinically, which could really treat patients. And then one of the guys, he didn't work for us back then, but he reached out to me. He told me, I know what you are doing. I think you should use AI. So my first question was not why AI, I was like, what is it? And so he told me, just a way to develop software. You should go and buy like GPU chips. We'll do this like training. Because back then, there was no like Google Cloud, Amazon, you should go to and buy these chips. And there was a shortage of them back then. I think it was just early era like of Bitcoin, so people were buying GPUs for that. And so why AI? Just because we based our technology on root and bone-based treatment planning. And how do we do it? Just by analyzing computer tomography. And computer tomography just gray and gray. So it's not like really like pure computer vision. And like AI just helped us to do like, to learn, from like experience, from the data set, and at the end of the day to deliver the best results to our patients. So who can see the vase on this picture? If you could raise your hands. And okay, 40%. And who can see two faces over here? And who can see at the same time vase and faces at the same time? But maybe just could you try one more time? Because usually you can see either ways of faces. You just cannot see them at the same time, two of them. Yeah, but yeah, this is like how we do, and that's like as human beings, and that's how like AI and computer vision in the early days like helped us, to do analysis of computer tomography and incorporate bone structure into treatment planning. So that's like that's why we started using AI before I found out what is it. And so yeah, we started like doing it when it wasn't fancy, and so we developed our proprietary AI models and trained on our data set. And actually earlier this year, Google reached out to us, and they just offered us to use their like generative AI tools to speed up our R&D. They just featured our technology on their blog, because like these days it's really difficult to find AI startups, these proprietary models and data set. A lot of startups on ChatGPT, and I think it's changing the world and the way how we'll develop software. But yeah, how AI is intangible. And as I mentioned, I don't know how to code. If you show me the code, I will never understand what they are, what like neural networks are there. So how AI works in real life. So for example, this is a patient. She's from Florida. She's 50 years old. She came to the doctor and to extract 4 of her incisors to put implants, because doctors could not like fix her teeth. And the doctor just used 3D Predict to straighten her teeth in 12 months. It's not possible with like other aligner company. That's how like actually patients and doctors benefit from this intangible AI for most of people. And there's another doctor patient from New York. She was a banker for one of our customer, and for sure he has been offering her for years, you should straighten your teeth, only braces. I mean, aligners want like help here. And she thought, I'm a banker, I cannot like do braces. Like I'm an adult woman, no braces. And then like in 18 months, he just fixed her teeth. And with braces, it would have taken like 3 years at least. And yeah, so that's how AI helped us to achieve our vision, because our vision was to actually make people's smiles of like health and beautiful smile come true. And by people, I mean both patients and doctors, because we sell B2B to doctors. We never see patients, almost never, but still our like end customer are patients, so we help them to change their life. And no Botox, no plastic surgery, just like straighten teeth, and you can see how we change, I mean, her appearance and her life. And then the question, as I mentioned, I had no like business education till like summer this year when I went to Stanford and where I met Jeff, and that's why I'm here. So if you created a great product, will it sell itself? So the answer is no. I mean, many of you, maybe you knew it before, but I had to know it like by learning, by doing. So I learned a lot. I mean, I knew how to develop medical product, how to do FDA approval, everything. But just because it was my previous education, my previous work. But I had to learn doing business, by doing, by failing, by like learning different painful and costly like tests. And so this year I had an executive program at Stanford, and the head of our program, Professor Burnett, you can see him on this photo, he told us, if you execute well on a bad strategy, you just fail efficiently. I know how to do it. I've done it before. So what you should do first, like start with a like strategy, and then, identify the product market fit. Only after that, just build a sales organization, like replicable sales process. Only after that, go to step 4. Only after that, like scale your business. And for example, if you go beyond markets, what does mean beyond markets? You launch a new product to the same audience, or go to other countries, go to step 1. For example, we were very, very successful, like bootstrapped, like a big company, like in Russia. I came to New York. I thought, we'll do the same. So I started like scaling without like doing the product market fit in the like US. But so I learned a lot, by doing, and I think it's really like important, but I love this journey. And so right now we are going to another like markets, to Latam, to Europe, to India, and right now we're starting in each country, we start from like step 1, because all countries are different. We're also looking go to like Hong Kong and China market, and for sure we'll start from step 1 for these specific geographies. Another lesson from Stanford I just want to share here. This actually was our value proposition. And here was, in the previous slide, there was a picture from the graduation ceremony, and then we had a lunch. And during the lunch, I sat down with our professor. His name is Jonathan Levav. He's maybe one of the most famous marketing professors at Stanford and Silicon Valley. And I told him, like our bank brags, they offered us to put our advertisement on Times Square for a week. It will be live in 2 weeks. And this is our value proposition, which we will put there on Times Square. And he told me, that people in California are very polite. You expect that, but he told me, this value proposition is shit. You cannot put it there. What does it mean 30% faster? I had braces for 7 years. I will have it for 4 years. It's like, is it a value proposition for me as a patient? No, you should change it. And then we brainstormed with him for a couple of hours. He told me just, if you sell to patients, add something, what they will understand. Like everybody knows orthodontic treatment takes for years. So like and with your AI, they could get, their smile ready by graduation, before wedding, before job interview. So it was we just changed it within 2 weeks. We called the marketing agency, you should change everything fast, and they told it only 2 weeks until it goes live. Let's do it. So yeah, and then we had a lot of actually benefits from that. So maybe learning from you can learn from your own mistakes, you can learn from books, but it's better, to learn from the best and also from other founders, I think. And everything that I've shared before, my journey, I've done it because of the team. It's not like by myself, and I think the team is very important. You should hire top talents, because top talents, they will tell you, use AI when you don't know what that. Maybe in 2 years, something else, another technology will help us to achieve our customer's goal. We'll switch from AI to this, new tech. I don't know what that could be. And so just hiring and retaining people is most important. And because they will achieve impossible goals. When I started the company and I thought my goal to develop aligners which could be as effective as braces. Right now we are even more effective than braces. Everybody told me, special doctors, it's not possible. You have 2 competitors, they're public companies, they invest hundreds of millions of dollars on R&D. They could not do it. So it's not possible. So that's why you have to hire people who could make these like impossible goals like real life. And as you see, 50% of our team are female. We don't have a specific like strategy to like hire 50% female, 50% male. We just have the job description and requirements for the job role. And if people meet like hard skills and if they have soft skills which fit our culture, we hire them. So just by hiring people which are suitable for the job, we just ended up like 50% of our engineers are actually females. And so this is my journey from the beginning till today. So right now we're expanding to other geographies, to other countries from the United States. But also we can use our AI platform to develop new products for periodontal health, to predict when your gum will be bleeding, or like predict like oral surgery, etc., etc. And I just want to share a key takeaway from my journey. First of all, you should start with a vision first. And vision should be big, which unmet need, big unmet need you are going to solve. It's easier said than done, but actually it also like thrills me when people tell you, it's not possible. So maybe we should do that. When everybody tells you this is possible, this is maybe a lot of people already doing that, so it's not really exciting. So, and if you know the unmet need of your customers, what do they need, then it will be very easy for you to develop a product. You just define what should be the outcome of your product. In our case, it was a clinical outcome. Another product, it could be like different outcomes. So it's very easy to define the product features and to the product development. And for sure, in order to do it, you should find the most suitable tech for your goals. For us, it was AI, and I believe maybe for 90 or 80% of startups today, of products today, AI will be helpful. But maybe next year something else will be helpful, or maybe for your product another technology is better. So AI is not like, it's not like ChatGPT will change us forever and all of us would like build products on top of that. In our industry, it's not possible, for example. And then just hire people who will do it. As I mentioned, like medical doctor, I didn't know how to code when I started the company. I don't know how to do it right now, and I'm not sure that I will ever know how to do it. But you should find like the best people in marketing, in coding, like just the best people and they will help you to actually build the product and build the company. So thank you so much for your attention. If you have any questions, please feel free to reach out to me. This is my contact information. I'll be always happy, to be helpful, because a lot of people, and mostly other founders, they helped me a lot during my journey. So I'll be happy, to give back to like other entrepreneurs.